I'm a holistic healer, and my approach is looking at head to foot, giving a whole body experience when you come to see me. I have trained for a number of years, gaining skills in many different techniques. I work with any structural injury, pregnancy, and also energy healing. I love to see people feeling more connected and to take people's pain away as much as I can. And I know what I do really helps people. I was made redundant about 11 years ago, could be a bit longer, I always forget about the years, from an insurance company. And for the last 7 years, I have been learning my skill and never stop increasing my knowledge and my skills. I'm going to talk about managing scars after breast cancer surgery that may help anyone who has or have cording. It's a light exercise. Sometimes it works, sometimes it doesn't. And there is another one, but we won't do that tonight. And I'm going to show you 5 help scar techniques to help you work with your scars on yourself for self-care. And then at the end, if you'd like to ask any questions, please do. Why did I get into scars and burns? It's not just all about scars, is it? Scars. It was a light bulb moment. It's when I was doing a dissertation. I sat because I didn't know what to do my dissertation of, and all of a sudden scars and burns popped into my mind. So I needed some case studies to prove my scar work techniques. I had learnt that they really made a difference. They really helped. And through Facebook, I found 14 people with multi-scars for my case studies. But I had 2 examples of case studies to validate the skill and techniques I use. I can't show you their photographs because of patient confidentiality. But one of the people that came to me was a young man. He had bone cancer in his thigh. He's still got cancer in his thigh. And he couldn't move. All he wanted to do was go to the gym, do a quad stretch. So I had to prove that the work I was going to do on him would allow him to do a quad stretch. He would have his movement back. The surgeon wanted to take his whole leg away and amputate it. And he said, no, I want to keep my leg. And he's still got it today, and he's nearly 50. And I worked on him. I did the scar work, but he'd also had a nasty radiotherapy burn on his leg. When they did the radiotherapy, they did it from the hip down to his knee quite considerably. They just blasted him. So his leg was all grimy, like leather, very hard. And I could understand why he couldn't move. He had quite a few scars because he had quite a few operations. He'd lost a lot of the muscle at the back of his leg completely. It completely eroded away. And with the radiotherapy, it made it worse. So over the course through the dissertation and working on him, the radiation burn softened. It changed in colour, his leg, which he was pleased about. The scars faded, but they're still there. You can't get rid of scars. Scar work that I do don't get rid of scars. It helps them to fade, it helps them to soften, and sometimes they go quite silvery. And at the end of it, he could actually do a quad stretch. He went to gym. But he also, because he was still under his surgeon up in Birmingham, he had to get permission. And I've also been oncology trained, so I can work with anybody who's got cancer. The next case study I had was a lovely lady, and she'd got cancer at the side of her nose and along her cheek. So she had a complete removal of her nose and a reconstruction of all down the side of her face. She didn't really want to look at it. She didn't really want to wear makeup. And she'd had it for quite a few years, though she was working and she was fine. She didn't like to touch her face. And after I worked on her, her scar softened, her nose got a better shape, because it's just cartilage. And the face softened and it plumped out to give her a nice sort of plump cheek. And after that, she was putting her makeup on, she was looking in the mirror, she was touching it, and she felt better about herself. But I also work with scars to help the adhesions, because the adhesions build up under the scars and round the scars. Our bodies, they're formed by interlacing structures, and we're designed to slide and glide. Whatever we do in all our movements, we slide and glide, and that's how we work through our fascial system with our muscles and our joints and the blood vessels. And when you have a surgical operation, when the scar heals, the scar can look lovely. It's really straight, really nice, really neat. But underneath, it looks like that. It's quite ropey, can be quite ropey, quite hard, quite knotty. So what I do with the work I do, I try and get that glide and slide back around the scar, underneath the scar and the body. Adhesions are like, if you can imagine a spider web that fans out, not just because it's lovely around what the spider does, but where it connects to the structures. And what it can do is a very commonplace with adhesions. They weave their way into other structures. They can, especially after women that have breast cancer surgery, that the adhesions can go towards the spine, to the back, down your arm, down the under the axilla. They can go into the neck. They can work down into the stomach, anywhere really, and they can really stick to your organs, any internal structure. You'd be surprised how they have the tentacles from these webs that go down. And adhesions can reduce the integrity of the area. They can create a pulling, a tightness, and it can give you pain. And it can be felt anywhere in the body. Women who have had a mastectomy or breast reconstruction, a lumpectomy, known as a wide local incision, there will be internal adhesions after surgery. Sometimes not very bad, sometimes they are. And we all know when you've had radiotherapy that it often can make your muscles and joints ache. You feel swollen, stiff. You have mobility problems, moving or stretching your arm into different ranges of motion. And we all know what chemotherapy can do before surgery and after surgery. You can experience side effects, a lot of side effects, or not that many side effects. But I have to be fully aware when I'm working with women that they also have a very altered or no sensations around the scar, around the reconstruction, or even if they don't have a reconstruction. But often women feel very disconnected after surgery. They don't feel whole. And they don't quite, sometimes when they lay on my couch, they say, I don't feel right. It feels uncomfortable. And after I find that I've worked on them, that people will get quite emotional because they feel that they start to connect, the body starts to connect, but also people can remember the trauma. It brings back a lot of emotions, what ladies have been through, and you do go through an awful lot of emotions. I must be aware at the time that I work on people too, people that go through radiotherapy, I have to make sure that I am only allowed to work on them 6 weeks afterwards. Between chemo is 4 weeks right between. So that often doesn't leave a lot of time. And sometimes people are not well after chemotherapy. So you don't come, you stay at home. You must be fully aware that you really have to look after yourselves. I'm going to mention donor sites, but I've taken a lot of what I was going to say because I didn't want to bore you ladies, to be honest, because you can quite go in quite in deep how things are done surgically, and half of you might already know or don't know. So I pulled back on that, and I'm sure many of you ladies have been through or know about donor sites, or you might not, like I've said. The different types of surgery, which they use your muscle, soft fat tissue, blood vessels, selection of skin, are used to reconstruct your new breasts. There's a tram flap, transverse rectus abdominis muscle flap, where surgeons, they use the tissues from the abdomen. They also take the muscles as well as the soft tissue from your tummies. There's a deep flap, deep inferior, epigastric profiter flap. They use the tissue just from the abdomen, your tummy, but it spares the muscle and it only uses the soft fat tissue and your local blood vessels. Another one, which I think they're not using so much now, which I feel is pretty good, is the latissimus dorsi, the big flap that goes down your back. It's the one, it's near your shoulder blade, and it goes right underneath and right down. They take an oval section of the skin, the fat, the blood cells, and the muscle through a tunnel under the skin, under the arm, chest into the wall, and they form a breast shape. But all the scar techniques that I work with actually help with all the scarring and all the surgery. Because if I work on reconstructions or not reconstructions or on the breast, and anyone has had, especially with reconstruction, the deflap, then that scar has to be worked too. So I work on a body as a whole, not just one area. What I like you, if you all would, lovely ladies, is to join in with me, and I'm going to give you some self-care massage on your scars. But there are things that you to remember. If you start working on your scars, you must remember you have to be very gentle with yourself. And it doesn't matter how old your scar is. It doesn't matter if it's 12 weeks old. It doesn't matter if it's 60 years old. All the techniques that I do help the scar to soften and all the adhesions to start healing underneath. But you must never push. You must never push on your body. If you get your hands and you take your arm and you push it down, you could do a lot of damage. So what you're looking for is you just rest your hand on. It's like a sweep, or if a feather, it's like a feather as you go across your body. Everything I do is very light touch, and it's like a feather. And also, before you do any work on yourself, think of what's that you're on silent, but on your face is the most delicate piece on your body is your eyes, your eyelids. So the best way to know that to touch your body is to actually touch your eyelids and feel the weight of your finger on your eyelids. And that is the pressure that you apply on any treatment that you do yourself. Yeah, if you feel it and you push your eyeballs in, they're quite springy, but you'll find that you can't push them very far, or you don't want to push them very far. And you just rest your fingertips on there, and that is as far as you go. You don't go any further. You just, or you can take, but it depends, you take your thumb and your finger and you press them together, and you can really press them. But then all of a sudden, if you take the pressure off, slide and glide. And that's what you're going to do when you work on yourself, is just slide and glide. So because if you push on your muscle, what happens if you push on your skin, the scar and the tissue under your skin is already compressed, or there could be really areas which are very compressed. And what you want to do when you work on yourself is encourage the subcutaneous layer through the fascia, the lowest of your skin level, and you want to encourage the fluid dynamics to improve. So it's like it plumps it up. Also, if you've got mesh, that is contraindicated. You cannot work on it. I am not allowed to work on it, because if you work on mesh can actually starts rubbing, cause inflation, makes the scar starts healing again, and plus give out more adhesions. So you don't work over a mesh at all, but you can work away from it. You can do lots of work down the arms, down the body, underneath, round, down the side. So there's lots of things you can do without touching mesh. So what you do is you put your hand on your arm. So I don't know if you ladies want to try at all with me. And what you're trying to do is, when you move the skin very gently, you've got a slide and glide. So that's what you're trying to do. But when you've got a restriction or adhesion, you'll find it won't move. They won't move. It will stick. And that's what you're looking for. But sometimes that stickiness is also away from the scar. But also, before you work, when you work on the scar, especially sometimes when people have had a lumpectomy and they've had radiotherapy, they often find the area is very, very hard. And some of the tissue have died on this. So you have to be aware that if you've got any hard tissue, which is necrosis, which is dead tissue, that's common in a scar as well, that when you work on it, and I work on it, you can actually reduce the hardness. You can actually reduce the size, and you can really soften. So the first exercise, the first one I'm going to teach you to do that you can do on yourselves, and you can ask me questions at the end, or you can contact me and we can do a private Zoom call and we can go through many things. But the first one is called sweeping, and this is lovely, and everybody should do this. You can do this when you wake up, the end of the day, middle of the day, and it's lovely and it's gentle, and it's just getting your hand, and all it is sweeping. You sweep along, you sweep towards the heart, always towards the heart, because it helps the lymphatics. And you sweep all around, and you sweep anywhere, neck, everywhere, all the way down. And you can sweep round, and you sweep, you can lift your arm up, sweep down, all the way round, and all the way over the breast and the scar. And that is lovely. And you can literally do that for 5 minutes if you want to. Have a clock, do it for 5 minutes. It's absolutely lovely. And that starts waking up all the skin, all the tissue, all the blood vessels, all the oxygen, and it really brings it to the surface, and you start thinking, oh, that's nice. And we've done the rocking. Oh, there's one, yeah, there's one, you can actually sit and slowly, if you wish, you can have it, and you can slowly just rock the skin but you're touching it very lightly, and you just rock it backwards and forwards, just backwards and forwards very nicely. And that's quite calming, and you do everything very, very slowly. When you have a scar, and it depends where the scar is and how it's affecting you, what the reconstruction is like, you can work along the scar. It's very difficult to show, actually. Work along the scar. So I've got a scar there, And you, at the edge of the scar, you get your index finger, you rest and you push down. You bring it off and you push it down. Very slow work. Press it down and you go up, press it down. And because sometimes the scar is very hard on the outside and you can feel, and you go round and you press. If it's a real long scar, you can press with all your fingers, very gently. This is called a delete key. So you go all the way around, very gently, like that. Or along the scar, you can do one. So you've got a scar there, and you can go all the way along. And there's a lovely one, which is called cat clawing. And you know when a cat, if anybody's got a cat, it does this. It likes to paw. So when you've got your hand, it's the only way I can show you is on me, or you can have a go. You get your claw, you get your hands and you sort of get them like little claws and you massage like this. This is lovely, really lovely. And you can do all over the scar, all the way around. It really is lovely. And you do it very gently, ever so gently. And you can take as long as you like doing that. And the fifth one is called combing. Say you've got your scar, I'll have to do it on here. Say you've got a scar here, so that's the scar there. And what you do beside the scar, you just do this. All the way up, all the way down, all the way up, and the other side. And when you're finished, you just sweep again. And then to finish it off, you just hold. You just sit and hold. You don't do it anymore. And you just, this integrates what you've just done. And the body starts reacting and starts healing. It's really, but you have to remember that's light work. And what you can do, you start off with 3 minutes every day, and then you build up the next week to 5 minutes every day. And then you can build up 10 minutes every other day. So you build it up very, very gently, and you have to be very gentle with yourself. Now for cording, this is a little bit different. As we know, cording, you can have one cord under the axilla, or you can have many offshoots of a cord come down. Now, I know after you've had operations, we have physios to help you get better to move. And so you're mobile again. But sometimes when ladies come to me, they've still got a bit of cording. It still hasn't gone. Cording's very stubborn. And there's an exercise, I don't know if you're going to be able to see, but it depending on how far you've actually got movement, to be honest. But you pick your hand as far as you can go and you keep it straight with the level of the shoulder. But what you do is you try and engage with the nerve. So you really push it out and engage with your elbow. And then you flip your hand up and you engage and you push it out until you can feel the nerve on the cord. And then you straighten your hand and then you bring it up and you straighten your hand and you bring it up. And you do that for 30 times. You count 30 movements and then gradually bring down your arm and rest it. And you can do that twice a day, just to help the cordon. I have got another routine that you do the cordon, and that is quite aggressive, but you do that on a wall, and you do that with your hand flat on the wall, facing, and you're facing that way. And also, while you've got your arm out, if you want, it's not working, turn your body. Turn your body, just rotate it until you can feel the pull in the arm, rotate it, and you can rotate your head. And you can move the head till you feel that pull all the way down as well, because you're all connected. It's all connected. All your muscles in your neck, connect to your back, down to thigh, it's all connected. So actually putting your hand out flat, then up, then rotating, you can really feel that in the nerve, into the tissue, and that really helps. So, and a little bit about oils and creams as well. It's important. I've got some recommendations for different companies that do have cream. I personally haven't bought from them, but I know that Emma, who trained me, because she specialises in women with breast cancer, she works at a lot of cancer sites, and she's done a lot of research and work on creams to use. But it is advisable to you always research your own creams to make sure that you're able to use them, and always check with your cancer nurse oncology team that the creams are right for you. That's very important as well. You don't just buy a cream and think that will be okay. If you're on chemo, that cream you might have a bad reaction to. So you've got to be very, very careful. But it's important to use a cream very, very quickly after you've had the operation, when your scar is healed and the scabs are gone. Then start using a cream or an oil. Because the stratum corneum, the first layer of your defense, that keeps out the environment, that keeps out infections, toxins, bacteria. And when the corneal layer is damaged, which it is when you have surgery, there's a lot of loss of moisture and water. So that signals down to the lower layers, the lower tissues, that the barrier function is now not working and you're losing a lot of moisture. So you have to moisture and keep that scar moistured and all around that area, because if not, the scar becomes particularly dry, then it starts laying down more scar tissue because it says there's no moisture there. So the scar says, it sends that signal, we're in trouble, so we need to lay down more scar tissue. Then you can end up with keloid scars or hypertrophied scars. But especially when you use a cream or an oil you never use on radiotherapy burns, never. It's always a cream. But you look, when you buy one, that it's been highly recommended and it's supported by evidence. And it does everything. And it stops water loss. It has a barrier function. It nourishes. It has properties which help with irritation. That's important, especially with radiotherapy as well. And your skin get very dry with chemo. Sensitive and for sensitivity, and has anti-inflammatory properties, which helps the scar. So there's one that I haven't found, I haven't tried to get any of the products here, and I know they will send me some samples. It's called L-Hydran, and it's ALHYDRAN, and I've got the website details if anybody wants it. This company has scientific evidence and is highly recommended. But as you know, ladies, if you've had to buy any creams or oils, they are very, very expensive. They are not cheap. And often when you've had your operation, you are allowed, or you will get a prescription that you can have creams and oils. I don't know if that applies to everybody. There's also, they do a lot of different creams, this company. They're really, really good. And I've had a look myself and I was surprised. There's a rose hip oil, but you have to buy a really, really good one from a health food shop. So you have to be careful with them. There's another person, she's called Jennifer Young, and they do a chemotherapy and radiotherapy products for ladies who experience cancer. I've got all their web details, but they're not cheap. They're really expensive. And I have taken up, they are really expensive, but they are good. And they have been scientifically proven to do what they say. There's another lady who's invented or researched a lot, and she's made up a very natural, using herbs, essences, and she's called Kerry Baxter. And she has a lovely scar oil. But also, it's best sometimes to do a lot of research yourself to make sure that it's scientifically proven, whatever you're going to use, when you no longer can have a prescription from the doctors and you still need to moisturize. Moisturizing is very important to keep that hydration. And so the scar underneath is just healing naturally, all the tissues, and it's not laying down any more collagen. So that's me for this evening. And I'd like to thank you all for coming and listening. And I hope you've enjoyed some of the information, and I hope you found it's very useful. And if you have any questions, I'll be happy to answer them. And I'm not sure if Jane is here.
Oh, thanks, Christine. Yeah, Jane's here. We've got a few Janes actually, so I just have to make sure we don't mix up the Janes, but thanks very much for doing that. It's really interesting. And we're obviously going to put your presentation online afterwards as well, so people can, and we'll keep the questions till the end. But before that, let me just introduce, well, obviously say thank you to Christine. That was really, really useful. And then I'll introduce a lady called Jane Hayes, who's with us. She's from Norfolk. She's been along to the Norwich support group when those support groups were up and running face to face in the old days before COVID. And our friends, Star Throwers as well in Wymondham, who are another cancer charity. And Jane is going to tell us about her breast cancer experience, her breast reconstruction story, and how Christine has helped her. So, yeah, so over to you, Jane. I'll just mute myself.
Thank you. Thank you. Hello, lovely to see you, Chris.
Hello, sweetheart. I couldn't see you down there, so
no, it's all right. There's a lot of people
bless you.
Sorry, so I've had grade 3 invasive lobular breast cancer. I was diagnosed in 2016. I had mastectomy and level 2 lymph clearance, and I had 5 out of 15 lymph glands. So after my mastectomy, I had chemotherapy and radiotherapy. I unfortunately had seroma. I had that drained because I really couldn't stand the pain of it. And I was told by my consultant, Simon Payne, sometimes when you do have this seroma drained, it can come back, it can make matters worse. Mine didn't come back, but it did concertina. So I had like a zigzag, like a drawstring bag scar. And that was incredibly painful, very, very uncomfortable. Eventually, I made the decision to have a DIEP reconstruction in 2018, mainly because of the discomfort that I had. And the surgeon, Miss Masood, said that she would be able to make a very good job of that scar line. We didn't think that would be a straight scar line, and it isn't. I do have a zigzag, but it actually looks and feels better than just what I had left. So I had that in 2018, and then I've had some other treatments. I've been to Star Throwers. I've had some massage therapy. And other bits and pieces, but nothing really helped as much as what Christine's work has done. So across my scar line, I have so that there's the zigzag is here, and across these bits, I have some indents and some hard lumps. Where I can't remember what that procedure is called now, where they have to go through the rib. In this bit here, I've got a particularly nasty area, and I've also got some bits up my axilla, haven't I, Christine, which are cording. I've got problems here. I've constantly massaged, and I've seen, I have lymphedema in my left arm, and I've seen Tina at Staffboroughs, and she's done an awful lot of lymphatic drainage and taught me a lot about that, and that has helped. That's been really good. But Christina's been able to deepen, and that has released some of that and helped with the pain. Mostly she's worked across the top of my breast. Unfortunately, I'm not sure, Christine, I've had, but it's only been 4 or 5, hasn't it? It's not many, because we had the 2 lockdowns, so it's been interrupted, but as soon as she's able to get up and running, I'm back there, and I'll be back there very regularly, because what she's done so far has made an incredible difference to a couple of the areas on the top of the breast and to one area at the bottom of the breast as well. So so definitely will be going back for more treatment there. She's used when she was showing the index finger to you all, she's done that on this area here. So I fall asleep. She's so gentle and kind with everything that she talks about and everything. Just very important, and she also does that. The whole experience is incredibly fulfilling, and you find your woman again, because of losing your I have had a lot of trouble with looking at my breast. I don't let myself be seen naked very much at all, because I'm very aware. Therapy has horrid split veins all the way around, which she has said, and I totally understand, probably split veins will not be able to be resolved at all. Sometimes in time they may fade. The actual scar, the tightness, the lumpiness, just those few sessions that we've had has started to make a difference, and I'm beginning to feel a little more comfortable. It's going to be a bit of a journey. I know I'm going to have quite a lot of further treatments and things to get it where I would like it to be. But it has all been just writing has covered that. The things that she said all about her work, it really has made a difference. It's improved. She's improved of psychological staff rows as well. If any of you have ever been there, amazing. But Christine's absolutely. Talking the other night, I said to her that I can feel, which I think she might have been a little bit amazed at, because we haven't worked on it for very long, have we? But it is working, and I can feel it. So, and when I remember, but very much, but I have been doing the little glide and the little index finger movements and things, and treating myself. She's a wonderful teacher, and I would suggest anybody who has got scar issues to go along and have a chat and see what she can do. She's helped me immensely.
Thank you, Jane.
And I think that's my story. What else I can say?
That's thank you, Jane. I'm not sure if anybody else has.
Is that all right, Carolyn?
Yeah, that's really good. Thank you. I think I had a few issues with it was in and out a little bit, but on the presentation we'll be able to see it again on the website. But I think one thing we need to do, Christine, obviously at the end, is make sure everybody's got your contact details, and we can put them up, or you can say them if that's all right. But perhaps you'd be happy to take some questions now, if that's okay, if there are any. And just to remind everyone to unmute if you do want to ask a question, because I think we're all on mute at the beginning.
I think someone asked what type of therapist I am. There was a question I know has come at the bottom, but I haven't gone into questions. I actually started my training as a Swedish and deep tissue massage therapist. Didn't particularly like Swedish. That's not who I am. And then I trained as I am an advanced clinical and sports massage therapist. I am quite a high level, so I was surprised when I got shut down again, because I should have been able to work even through this lockdown clinically, but they said no. And through the BTEC and doing the dissertation, but my dissertation, because I do scar work, I am so passionate about the scar work. It's just wonderful. And every year I go on refresher courses. The lady I trained with, that's trained everybody, she comes over from America. Sharon's absolutely fantastic. We all do refreshers, and I've got one at the end of the year because it was all cancelled last year with her. So she finds new techniques, new way of working, so to keep herself going forward. And also Emma, she works a lot, which I said, with adapting all her techniques, which Sharon taught her, and to be a teacher, and she's taught me, and to work with women with breast cancer, and to really find techniques that work for women, especially with the cordon. It says, what, you can't do it on yourself because you need me. There's a special way that I have to hold an arm, and I really get into that axilla under your arm to really try and break the cording. And you often hear a lot of snapping, grinding, popping sounds as well. It's interesting. But I also work, which I said to Carolyn, I do, it's called TMJ, which is temporomandible joint disorder, which is jaw dysfunction. And I work with people that have jaw dysfunction, that can't open, they grind, or they're having aches around the condyle. And they're my two, I've got three passions. And what I love doing at the end of my treatments is energy healing. I'm an angelic Reiki healer. And Jane loves it. At the end of a session, we bring in energy healing and I give her a healing. And that also integrates what I've done, because that gives her body time and everybody's body to sit, relax, and feel my energy. And you know, I don't know whether you believe or not, but I do. I work with the angels, and they come in and they do the healing, and it's absolutely fantastic. I love it. But you know, I do other ways. I do. You know, people will sometimes come to me for pregnancy massages because I do different technique. I was taught to pregnancy, and it's not just about doing a bit of rubbing on the back or down the neck. You actually move. You stretch the limbs. You stretch the muscles. Because even the scar work I do it's called myofascial work. Everything is myofascial. Under our bodies and skin, we have a fascial system, or myofascial system. And it's that which helps us to move and glide. And it's important. And the surgeons are getting better, but they don't always do it. When they do the surgery, they don't sew it back because it's like liquid, they leave it. And that's where the problems are coming, because the fascia connects us from your big toe to the top of your head. And it's that which helps us to move as a human being.
Christine, I hope you don't mind me just asking you, we've got a question in the chat where, well, there's a question I'd like to ask you as well in a second, but one of the ladies was asking about your techniques. I know you said to do, at the beginning, you said to do them maybe for 5 minutes in the morning and 5 minutes in the evening and then make and build up. But are you suggesting doing those sweeping techniques and the rocking and the combing and all of those? Are you suggesting doing those daily or every few days, or?
You can do those daily because they're the sweeping. If you hold the scar and you can just sweep down, it's very light. Everything is a light touch. If you think about getting a feather, then you can work very lightly. So all of those, even the delete key, though you do press down, but it is very light and very springy. And then you can just gently move or do the cat round. But yeah, once a day.
And this might just be me not really quite understanding, but I just wanted to clarify. So the sweeping and the massage you were saying about the very light touch, is that with or without an oil? And is that just with the pressure of your hands you were thinking?
That's without an oil.
Without an oil.
Yeah. Everything you massage is dry without no oil at all. Because
or cream.
Yeah, or cream. Because if you put an oil on, you will slip, and you won't do anything. So what you're trying to do, you're trying to create movement, and you're trying to, especially the delete key, you're trying to soften the scar. So if you had cream on, you would actually end up doing nothing because you would slip. So you're engaging with your skin, but just the top layer of your skin, and that's all you're doing, and then you press in.
And then with the creams and the oils, that's separate, that you would then use those to do the massage in a particular area. And I know you said there's some quite expensive ones, but people can use their own creams, can't they?
Oh, yeah. Oh, yes. Yeah. You use your own, whatever cream suits you, use it, but use it. Never stop using it on the scar and around the scar to keep it hydrated. That's the most important thing, is keeping your scar hydrated. Your body hydrated is very important. It's not just about taking water in, but it's stopping and resealing that barrier.
And somebody's asking how often you should put the cream on. I don't know if you can see that, chat.
Yes, I can. Yeah. Well, you moisturize. If you moisturize every day, you have a shower or wash, you moisturize every day, just once a day, really. But with a scar, if you notice it is a bit dry, I would do it more than once a day. Actually, if the scar feels dry, I would do it 2 or 3 times a day myself. But it must be healed and it mustn't have a scab on it. That's the most important.
Brilliant. Can you see the other one?
Do I have to massage for life then? No. No, you don't. No, you don't. It depends on how you feel, how your scar feels. If your body feels fine, it feels connected, your scar is soft, the area is soft. No. It's entirely up to an individual whether you feel you need to massage or not. Have you been told to use the cream on the scar? You should have been told if you, after your operation or before your operation, actually it's not after, that they have used mesh. And it's most important that you know before any operation that they are going to use mesh on you. That's quite important, and where they're going to use it. Sometimes they will put a tiny bit of mesh around the navel. So, and when you do, I mean, so I've got a lady that comes, she's got mesh around the navel, but I wouldn't work there. I work away from it because you don't want to upset it. So it's quite important.
Great. Thank